Welcome back, performance guys. All right, I am trying something a little different, obviously, tonight with the countdown to give you time to get in subscribed and get watching. I see we have, let's see, Amanda, Tim, Mira, Elizabeth. Welcome to the live feed. So we're going to be talking about nerve entrapments. And I wanted to try to bring some content here that you can take tonight, go home, or if you're sitting at home on the couch, really utilize it to get rid of the numbness and tingling in your hands. Now, numbness and tingling can occur throughout the body through different forms of nerve entrapment. And we want to make sure that right now we're just going to be talking about the hands. So let's make sure, one, can everybody hear me? Because I have a different setup tonight than what I usually use, and I'm a little nervous. So give me a thumbs up if you are hearing me okay, and we'll get right into our presentation and what you can do so I don't take too much of your time of your evening up. And then at the end, we'll answer any questions that cropped up during the video. So with that, let's get into this. So we're really going to be talking about nerve entrapments in the upper arm. And this is your carpal tunnel, your cubital tunnel. And you might be going, well, I've heard of carpal tunnel, but what's this cubital tunnel? By the end of this, you're going to know what that is. So what does it mean when a nerve is entrapped? This is where there's direct pressure on the nerve. Somewhere there is something squishing that nerve down, and it's affecting its ability to send signals back and forth. So our entire body is controlled by our nervous system, which ultimately our brain is the computer of. So we have our brain, down the back is our spinal column. We have tiny nerves shooting out from that then control the rest of our body. Now, it both sends signals out so we can move, and it sends signals back to interpret pain, heat, how we move, how we touch, how we feel things. So when that's interfered with some direct pressure, we get symptoms. And these symptoms can be caused by conditions such as diabetes, can affect your ability to transmit nerve pathways. This is why when diabetics can lose their feet and have to have amputations because they can't feel that they've sustained an injury, high blood pressure, some neuro disorders. Pregnancy can affect this. Numbness and tingling in the hands is really common in pregnancy and is, I'm not going to say normal, but it's not uncommon. But then there are some mechanical issues, such as a herniated disc in our spine, if we sprain or do any damages, if we break a bone, if there's a muscle spasm. All of these can contribute to us having some form of nerve entrapment and thus having the symptoms and the pain. Now, where are these most common? So we have our carpal tunnel. That's going to be right here through our wrist. I'm going to use my wrist that doesn't have a watch on it. And this affects these three fingers. And that is the most common one you think of. Now, cubital tunnel syndrome goes through our cubital tunnel, the tunnel of Guyane for our anatomy nerds out there. And that affects our outer finger, this side of our ring finger, because this side of our ring finger is controlled by the median nerve. I know you're going, oh God, anatomy. If you don't remember, it's okay. Well, you need to know, outside of the hand, controlled by the ulnar nerve, and that's your cubital tunnel syndrome. Inside of the hand and thumb is your median nerve, and that's your carpal tunnel. Now, a little bit more of a rare type of compression is our radial nerve compression, and that's our back of the hand. So we can kind of see this here. So we have blue for median, orange for ulnar, and green for radial. Those are where those numbness and tingling. You might be going, well, my whole hand is numb. Well, not one nerve has to be honestly affected. You can have multiple nerves entrapped at the same time, which is incredibly frustrating when you're trying to figure out what you need to do for treatment to get better. Now, I'm just going to slide that deer Now, I did have a good question, and this one I'm going to answer is this different than numbness from texting? Honestly, not really. So these symptoms can crop up from long-term use, so typing at our computer and the nerves get compressed because of the position of our hand. But when texting on a phone, our hands are held in awkward positions, and this can create those entrapments. Now, easy way to fix it is not to be repetitively in that position that's creating that numbness. But yes, using your phone and texting and having your hands go numb and tingly, this can be a contributing factor. Now, there is multiple things that can be causing nerve entrapments. So the disc herniations, you can have the entrapment of the muscles, you can have a medical condition, and then you can also have something called thoracic outlet syndrome. Thoracic outlet syndrome is where the cervical spine and your thoracic spine impinge on other nerves, other blood vessels, and cause issues. So if the stretches I give you tonight don't give you any relief, remember, it's important to follow up with a trained medical professional, whether it's physical therapist, medical doctor, or a sports chiropractor, to really determine what's going on with you. So the symptoms, we're really focusing on pain, tingling, numbness, and muscle weakness. So if you're starting to have grip strength affected, and this can be an issue when your grip is important. So sports-wise, let's look at hockey, requiring to grip a stick, typing, having the dexterity on your keyboard to type, having a common place that these symptoms crop up is in the morning, potentially for how you slept. You can wake up with pain, tingling, and numbness in your fingers. Those are really frustrating. And these can be intermittent or constant symptoms. Intermittent being they come and go, they get worse with certain activities. So prior to going into someone to be seen, it can be important to track when these symptoms are the worst. This allows you to be able to tell them, hey, after I do this activity, it's a lot worse. It gives the provider a snapshot picture of what's going on. If they're constantly happening with no improvement with a position, no improvement with stretching, and it's just constantly there, that could be a sign of an underlying condition that could require different testing. So that's like your diabetic neuropathies. There potentially could be a tumor pressing on the nerve. If it's truly a muscular nerve entrapment, then it should improve with some conservative care. Now let's talk about some treatment options. Now these are just general options. There is medications you can take. In the past, they've recommended splints, specifically a splint called a cock-up splint. It puts your wrist in a nerve-sparing position. Granted, for splints, I don't like to use them because they prevent you from moving. And ultimately, our body does better when we can move more. So if it helps you sleep, it's great. Our body has to heal, we need to sleep. So wear it if it helps you sleep. If you're not really getting any relief from it, I would probably put it away. You can attempt steroid injections. Granted, they have some gnarly side effects because they can increase degenerative changes within joints. They can cause breakdown and increase in osteoporosis as it thins the bone. So make sure before you go to that step that you understand all the possible consequences. There's physical therapy and chiropractic care as a conservative, non-surgical option. And then there's the surgical option. With all patients, I go, hey, make sure you try everything conservatively first. Granted, when your job relies on your hands having the dexterity to do a task, it's hard to push and have not be able to use your hands. So I understand things can be hard, but it's really important that we effectively attempt treatment and follow the recommendations for home care. Now, the other option is surgery. One thing, so this is pulled from some research articles, 90% initially after surgery, 90% improvement. You have less numbness and tingling instantaneously, which is awesome. So you get that relief. But long-term studies really haven't been tracked after 2 years. What they are finding is that after surgery, 85% of patients will report a return of numbness and tingling in the hands. 85%. Maybe not as severe, but they will have some return of symptoms. After the first surgery, long-term, 50 to 60% will have some success. And after a second surgery, which happens more frequently than we care for, only 35 to 40% will have success. So before you take the surgical route, we really need to discuss what other options you have for this. And this is where I want to give you some stretches to do at home to help with numbness and tingling in your hands. So we're going to scoot back. I hope you can still hear me. It looks like everything's good. So if we're looking at our hand and trying to determine where we are feeling numbness and tingling, granted, as you do these stretches, you might feel some of the symptoms because we're going to be putting some tension on those nerves, and nerves don't stretch. So we're just going to be moving it back and forth through the canal that it travels through our body. So you might feel some numbness and tingling, but the more often you do this, the less frequently it happens. For me personally, I have issues with my pinky and pointer finger. So I have cubital tunnel. I have ulnar nerve entrapment because it really sticks right here, and it's common for chiropractors to have that for how we adjust. So this is something I do at home to kind of manage my own symptoms. So that one, to see if you have issues, I'm going to take my glasses off. You do what we call Batman goggles. So you flip your hands up and see if your fingers go numb. If you feel symptoms of numbness and tingling when you have your hand up like that, and I definitely feel it on my right side, that's indication that your ulnar nerve can have issues. So how we're going to floss this is to lean our hand in and then push our hand away. And we're just going to keep repeating this for 5 to 6 times, just kind of moving that nerve in and out. And as we do this, the symptoms in my hand decrease. So that really helps my pinky and pointer finger have less symptoms. So I do this once in the morning, once at night, and I haven't really had any major issues with my hands going numb and waking up in pain. Now, for our next one, which is our median nerve, so our true carpal tunnel, this is going to be focusing on the palm of our hand. We're going to stick our hand out straight. This is going to put it full on stretch, so we're going to lean our head towards our hand, and then as we bring our wrist in, we're going to lean our head away. And we're just going to repeat this back and forth for 5 times, stretching and letting that nerve kind of just shift back and forth. If you want to see it at full tension and if you have symptoms, you extend the wrist back, you extend the head away, and I can only go to about here before it becomes pretty uncomfortable for that to happen. So again, we're going with the hand to move it back and forth. If we want to see if we have symptoms, which most people will, we test it that way. So that's your median nerve. Next is our radial. This one goes down. Hand down puts the nerve on stretch. So our head goes towards. And then we move our head back and forth. This one I really don't have any issues with for discomfort. So stretch to and from. Now those are 3 really simple things to do, and I give these to all my hand numbness patients, and it's made a significant difference for keeping them out of my office, which is great for the patient, not necessarily good for me. But that's my goal. I want to give you stuff that keeps you out of office and keeps you doing what you need to do. So those 3 stretches can really help anything going on with numbness and tingling in the hands. If you don't see a significant improvement in your numbness and tingling, please go see someone, whether that be your medical doctor, physical therapist, or your sports chiropractor. So I'm going to open the floor to some questions to see if anybody has any based off what I presented. I kind of ran through that really quickly for a quick overview of how you can self-manage a nerve entrapment in your arm. And if no one has any questions, I would also like to say that if you watch this live, thank you for joining me. If you have any questions after the live, hit #replay and post your questions. And next week, if you have a topic, put in the comments what topic you would like me to talk about. So every Tuesday night, we're going to be doing a live feed, whether we're going to try to keep it at 6:30 Central Time. Occasionally, I'm going to have to move it around with my sports schedule. Basketball season is afoot, and they start pretty early and go pretty late. Here we go. We have a question. So we'll try to keep it at this time, but it might flex a little bit. So we have a question concerning massaging the cubital tunnel the same as carpal tunnel. So this is coming from a massage therapist asking where we treat. So carpal tunnel we treat in here, tunnel guyon we treat in here. We have our cubital tunnel out on the elbow, and I realized I said this is the tunnel of Guion, so this is your ulnar nerve entrapment, which is less rare. Cubital tunnel or golfer's elbow entrapment is out here. Oops. So cubital tunnel entrapment comes out here. I like to work this whole area. What's nice is if you were to stress the nerve, so let's say you're looking at that cubital tunnel, the ulnar nerve entrapment. So you have them go up and you have them put in this position where they feel the majority of the symptoms. So where the person feels the majority of the issues. So mine is right here in my hand. That's where you want to treat. So as you put the person in the position of stretch, you massage the hands. So when I'm feeling really numb and tingly, I'll rub my hands, I'll grab one of my soft tissue instruments. Let me grab it. One of my instrument-assisted soft tissue devices, and I'll simply just scrape along where I'm feeling a lot of the tightness, which is what I would do for a patient. I retest, and where I now feel the next bit of tightness is where I'm next going to work. So this actually helps you map where the muscle entrapments are for the patient and give them the most amount of comfort. It also gives the best amount of relief. So I worked with a individual that had a lot of hand numbness that was an electrician, and we did this because they had surgery scheduled. They were freaking out because they were concerned with being able to provide for their family, and they couldn't grip the tools to actually perform the task. So we ran them through this whole thing, gave them the exercises, and we actually got them out of pain and symptoms to a point that they didn't have to come in and see me anymore. They had canceled their surgery and they were back to full function. And then they would follow up about every 6 months just for a quick cleanup and continue on with what was going on. So it really is a nice option of conservative care. Now, as things progress, you might get to a point where you have to have surgery, but if you're diligent in your stretching, diligent with your maintenance of soft tissue care, whether seeing a massage therapist, an acupuncturist, you really can manage this without having to go the surgical route, which saves you money, saves you pain, saves you those types of side effects. It's kind of nice. Any other questions? Tonight was a rather quick night. Again, if you're watching this live, thank you. watching it on replay, hashtag replay. I will happily answer any questions you have. And with that, I hope tonight was beneficial for you. And at Mobility Agility Chiropractic Performance, we thank you for joining so that we can help you get better faster, stay better longer, because no one has time to be sidelined. Have a good night, everyone. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.